There has always been something about youth that makes you feel invincible, like you are untouchable and impermeable to all sorts of diseases and dangers. This can often lead to reckless behavior and a disregard for personal safety. This not only translates to wanting to go on adventures and being less than cautious with our everyday lives, but it can also lead to ignoring health concerns, thinking, "Nah, that can't happen to me. I'm far too young for that." Unfortunately, that isn't always the case. If you've seen the news lately and have read about the seemingly healthy young men and women who have suddenly dropped from a heart attack or have been taken ill with conditions like stroke or even cancer, you'll come to question yourself, is there really such a thing as being too young? In today's video, we'll list 5 health problems you're actually not too young for. Check out number 3, it's kinda scary. So is number 5, come to think of it. Let's get on, starting with number 1, high blood pressure. High blood pressure is something we usually attribute to middle age, and maybe not even then. Many think you can't possibly have high blood pressure or hypertension as it's medically referred to in your teens, 20s, or even early 30s. Surely that is something reserved for your 40s at the very least. But as you may have already guessed, high blood pressure can strike anybody at any age. High blood pressure isn't just an old person's disease. It is called a silent killer because often it has no obvious symptoms. But over time, if left untreated, it can lead to serious health problems like heart disease and stroke. So how exactly does high blood pressure sneak up on younger people? Well, factors like obesity, lack of physical activity, excessive salt intake, and even stress can contribute to high blood pressure in younger people. A study published in the Journal of Hypertension found that nearly 1 in 4 adults aged 18 to 39 had high blood pressure. That's a pretty alarming statistic. But here's the good news. High blood pressure is not only preventable, it is also very manageable. Eating a diet rich in fruits and vegetables, reducing your salt intake, exercising regularly, and managing stress are all effective ways to keep your blood pressure in check. Medication helps as well. You need to have a regular checkup done, and once your doctor determines you have hypertension, you may be given maintenance medication to help keep your blood pressure within the normal range. If you are obese, weight loss is recommended. Studies have shown that losing even just 5% of your current body weight if you're obese can have significant health benefits when it comes to blood pressure management. Exercise is key too. If you keep an eye on your blood pressure, you will notice a significant drop in it following a cardio exercise like running. If you keep it up, regular cardio exercises can also greatly benefit your health and keep your blood pressure normal. It is also important that you watch what you eat. Stay away from foods that have too much salt or sodium and bump your potassium intake whenever you can. And guess what? Dark chocolate might also be your new best friend. A check of studies published in the Cochrane database of systematic reviews found that eating dark chocolate or cocoa products rich in flavonols can reduce blood pressure in people with hypertension or even pre-hypertension. Flavonols are plant compounds with antioxidant properties. They help dilate blood vessels and improve blood flow, which can lower your blood pressure. But remember, moderation is key. While dark chocolate has health benefits, it also contains sugar and fat. Be sure to enjoy it as part of a balanced diet. Number 2. Type 2 diabetes. Type 1 diabetes, previously called juvenile diabetes, is a condition associated with the young and is usually due to problems with the pancreas. This form of diabetes is often diagnosed in toddlerhood or right before a kid reaches their teens. The other type of diabetes, called type 2 diabetes, is usually considered a lifestyle disease. This means that it comes on as a result of poor lifestyle choices, like poor diet and being sedentary. Type 2 diabetes happens when your body becomes resistant to insulin, which is a hormone that regulates blood sugar. This results in high blood sugar levels, which can lead to serious health problems like heart disease, kidney damage, and even blindness. In the past, we would see type 2 diabetes start to happen around the mid-40s or early 50s. But these days, the age of onset is getting younger and younger. The so-called cardinal signs of diabetes are changing as well. Before, doctors would suspect that you have diabetes if you experience the 3 Ps, which are polyphagia, polyuria, and polydipsia, or too much hunger, too much thirst, and peeing too much. These days, young people can still have developed type 2 diabetes without experiencing all of the 3 Ps. This is why it is important to get your blood levels checked on the regular. That way, you can catch irregularities early on. Luckily, like hypertension, diabetes is manageable, and if you only have been diagnosed with pre-diabetes, you'll be glad to know that the condition is reversible. Quick tip: one food item that can manage and even prevent this condition is whole grains. Whole grains are packed with fiber, which slows down the absorption of sugar into your bloodstream and prevents spikes in blood glucose. A study published in the American Journal of Clinical Nutrition found that people who ate the most whole grains had lower risk of developing type 2 diabetes than those who ate the least. But beware of food labeled as whole grain that are actually packed with refined grains and sugars. Always check the ingredient list to make sure whole grain is listed as the first item. And remember, don't only focus on adding whole grains to your diet. It is also about cutting back on processed foods and sugary drinks, which can increase your risk of type 2 diabetes as well. Number 3. Now this one is quite scary. It's strokes. Like the other conditions on this list, strokes are something that many of you will attribute to middle age and even old age. But as many of you already know, it can happen to much younger people too, even those who are seemingly healthy and have no known health issues prior to the stroke. A stroke occurs when there is a disruption in the blood flow to the brain, leading to brain cell damage. This disruption can be caused by a blockage in an artery, causing what is known as an ischemic stroke, or a rupture in the blood vessel causing a hemorrhagic stroke. Despite their rarity in younger individuals, stroke can have a significant and sometimes devastating consequence for young adults. Several factors can contribute to strokes in young people. One primary factor is underlying health conditions. Older adults typically get issues like high blood pressure, diabetes, and heart disease as they age. But young adults can have the same problems due to genetics, lifestyle choices, or other medical issues too. Lifestyle choices play a significant role. These can include poor dietary habits, lack of exercise, smoking, and excessive alcohol consumption. Add to that risk factors like obesity, high cholesterol, and hypertension, all of which are known to increase the likelihood of stroke in younger people. Certain medical conditions unique to younger individuals can also predispose them to strokes. This includes conditions like sickle cell disease, which can cause blood clots and arterial dissection, or where the lining of an artery tears, leading to reduced blood flow to the brain. Moreover, certain lifestyle factors more common in young adults like illicit drug use or the use of hormonal contraceptives can also increase their risk of stroke. Recognizing the signs and symptoms of a stroke is crucial for young adults and for those around them. While symptoms may vary, common signs include sudden weakness or numbness on one side of the body, difficulty speaking or understanding speech, severe headaches, dizziness, and loss of balance or coordination. It's essential to seek immediate medical attention if these symptoms occur, as early medical intervention can significantly improve outcomes. The key takeaway here is the fact that strokes can occur in individuals at any age, including young adults. By understanding the risk factors and the signs and symptoms of stroke, young adults can take proactive steps to maintain their health and reduce the risk of experiencing this life-altering event. Number 4. Colon cancer. Colon cancer, traditionally associated with older adults, is increasingly affecting younger individuals. While the majority of colon cancer cases still occur in people over 50, there have been a notable rise in diagnoses among younger people. This trend has prompted concerns and highlighted the importance of awareness and early detection in the younger population. Several studies have shed light on the factors contributing to the rising incidence of colon cancer in young people. A study published in the Journal of the National Cancer Institute found that colorectal cancer incidence rates among individuals aged 20 to 39 years have been increasing by 1% to 2.4% per year since the mid-1980s. This upward trend is particularly evident in rectal cancer cases. A study published in Cancer Epidemiology, Biomarkers and Prevention have identified high intake of processed meats, red meats, and sugary beverages as risk factors associated with the development of colon cancer in young adults. The study also highlights the impact of sedentary lifestyles and obesity on colorectal cancer risk, thus emphasizing the importance of maintaining healthy weight and engaging in regular physical activity. Genetic predisposition also plays a crucial role in the development of colon cancer in the young. According to research published in JAMA Oncology, individuals with a family history of colorectal cancer or hereditary syndromes such as Lynch syndrome and familial adenomatous polyposis have significantly higher risk of developing colorectal cancer at a young age. Genetic mutations associated with these syndromes can substantially increase susceptibility to the disease, even in the absence of traditional risk factors. Moreover, environmental factors and exposure to carcinogens may contribute to the development of colon cancer. Some studies found that exposure to tobacco smoke, industrial chemicals, and radiation may increase risk. Early detection is crucial regardless of age. Screening tests such as colonoscopies are recommended for adults aged 45 and older, but younger individuals with a family history of colon cancer or concerning symptoms may also benefit from early screening. Additionally, promoting awareness of colorectal cancer symptoms and risk factors among healthcare providers and the general public can help facilitate timely diagnoses and treatment in young adults. Number 5. Heart attacks. Heart attacks, once primarily associated with older adults, are becoming more prevalent among the younger individuals, sparking concerns among healthcare professionals and researchers alike. A study published in the Journal of the American College of Cardiology revealed a significant increase in heart attacks among adults under the age of 40 over the past 2 decades. Researchers found that between 1995 and 2014, the incidence of heart attacks in this age group rose by 2% each year. This upward trend is particularly alarming as heart attacks in younger individuals are often unexpected and can have severe consequences. Several studies have identified various risk factors contributing to the rise of heart attacks in younger people. Factors that have been found significant to the development of premature heart disease include obesity, high blood pressure, and diabetes. Researchers found that individuals who were obese or had diabetes in their early 20s had a significantly higher risk of developing heart disease by middle age compared to those without these risk factors. Genetic predisposition has also been identified as a crucial factor. Furthermore, lifestyle choices such as smoking, sedentary behavior, and poor dietary habits contribute significantly to the risk of heart attacks in younger individuals. A study found that smoking during young adulthood was associated with a higher risk of premature heart disease, even among individuals with no other cardiovascular risk. Additionally, high levels of physical inactivity and a diet low in fruits and vegetables and whole grains have been linked to an increased risk of heart attacks in the younger population. If you want to lower your risk of heart attacks while young, adopt a healthy lifestyle, eat well, exercise, and avoid vices like smoking, drugs, or drinking. If you are interested in more videos like this, check out the playlist linked above. Also, if you haven't yet, like this video and please subscribe to our channel. Also, click on the bell icon so you get notified whenever we post something new. We usually post 3 to 5 times a week, so be sure to come back regularly. We are your wellness journal. Have a healthy day.